Hello, everyone. Today, I'm so honored to be here to interview Dr. William Wennon, who works for Fairbanks Memorial Hospital for 45 years. His specialty is plastic and reconstructive surgeon. Today, we're going to talk about AFib condition. Hi, Dr. Wennon. How are you today?
Doing well, thank you.
Thank you for being here with my assignment. Thank you so much. So, would you please tell me what's the AFib?
Well, many years ago, I think I developed what's called atrial fibrillation, and what that means is that the heart doesn't have the usual rhythm that it should have. It means that the upper two chambers, the atria, are consider it like they're shivering. They're instead of beating, they're just sort of shivering, and so they're very inefficient. The larger chambers, the ventricles, are regular, but they are sometimes irregular because of the atrial fibrillation. Sometimes they're slower, sometimes they go a little bit faster. So there is the pumping irregularity from the ventricles becomes a little bit irregular as well.
So, what causes for the condition?
I don't think anybody knows. Some people are born with it. There are people who develop it after at a later age from a heart attack type situation where parts of the heart muscle get sick from lack of blood supply. And nobody knows for sure exactly what the cause is. There may be many causes, including perhaps a viral attack.
So, what happened when you were first diagnosed with the condition? Are you feel upset or you feel sad or any change in your daily life?
No, I was kind of happy to know what it was. Because I felt that, okay, this is what I've got. Now we got to see what can be done to fix it. Because once you made the diagnosis, okay, now you go to fix it. And gee, that's a fairly positive way of looking at life.
Oh, thank you for your optimistic perspective. And how's the treatment? What kind of treatment do you have for your condition?
Well, I've had several. The first one was called a COX-3 maze procedure. It was done at the Mayo Clinic in southern Minnesota because there was nobody here in Alaska that was doing that kind of surgery. They thought it might be the best way to control the atrial fibrillation. And what the COX-3 maze means is that it's an open heart surgery, and there are incisions, surgical incisions, made in the upper two chambers, the atria. But it's done with a very special pattern because the stimulus for the atriums to beat comes out of the pulmonary vein before it goes into the heart. Well, so what the scars do in the upper chambers is it prevents an irregular stimulus from happening.
Thank you so much.
That's at least it is supposed to do that.
Thank you so much for your information. So after the surgery, any change in your daily life, like any effect to your schedule as a physician? You with the busy schedule, the surgery the procedures, is it any effect or anything difficult for you to perform?
Well, at first, yes, because it's the open heart surgery is kind of taxing on anybody. So it takes a couple 3 months of physical therapy and that sort of stuff, and being on certain medications for several months while your heart adjusts to all of this. So you don't go back to being fully physically active right away. It's gradual, and so as the patient, me in this case, as my physical well-being increases, then I can do more work. At first you don't work as long, you don't do as many surgeries, you go a little slower, and the better you feel, however long that may take, then the more you can do.
All right. Thank you so much. I appreciate the information that you share with us today.